Hey everyone, I'm back again. Remember the last time we spoke, I told you that we're going to be talking about the myths associated with pap smears. Now, there's a lot of things going on out there, and there's a lot of things that people are saying that is associated with pap smears, and it's just not the truth. Right? So stick and stay with me as I get through some of these misconceptions that are associated with pap smears. Okay? So let's get right into the video. One of the main reasons why there's so many women out there who really do not want to get a pap smear done. And this thing is that it is painful. Now, a pap smear is not supposed to be painful. You're not supposed to have a painful pap smear, right? So if you went somewhere and that person made it painful for you, i.e. even myself, please go somewhere else, get it, because it's not supposed to be painful. If you're having pain during your pap smear, it can be for many reasons. One, probably you have vaginal infection, PID. Those are things that can make your pap smear painful. So if you're having that, it's best for you to get yourself sorted out, get treated. And for persons who have these infections, even sexual intercourse can be painful for them as well. So, but your pap smear is not supposed to be painful. All right? For some people, it can be uncomfortable, but not painful. All right? So, ensure that you're going to someone who does regular speculum examination and who takes the time to get your pap smear done, talk to you during the process, ensure that you're comfortable when you're getting your pap smear done. It is also important for you not to be too tense when you're getting a pap smear done. I know for some persons it's hard not to get tense because you really don't want anybody to be down there in the first place, but for more comfort, I encourage it. All right? But your pap smear, and I repeat, should not be painful. The next thing that I've heard about is that pap smear can take your virginity. A pap smear should not be painful. Remember that we said that, right? So therefore, a pap smear should not be that rough where it's going to be taking your virginity. Remember, your virginity is determined by some people, not everyone, by the hymen that is at the entrance of the vagina, right? So if that hymen is ruptured, it is considered that you took your virginity was taken. But taking your virginity is a sexual act either way, and as long as you weren't sexually active, there's no way your pap smear could take your virginity. The next thing is that some women were not born with the hymen there. So because of this, we cannot say that a pap smear took the virginity, especially if you were not assessed to identify whether you have a hymen or not. So therefore, you cannot say that a pap smear took your virginity. All right? Virginity taken is sexually, whether it's with digitals or with another digital. But sexual activity is considered to be the only reason you would lose your virginity. Okay? So, another thing that a lot of people say is if you have one sexual partner, you do not need a pap smear. All right, you have one sexual partner, your chances of getting a sexual transmitted infection is lessened. But remember that HPV is not the only reason why you get cervical cancer, and that is what the pap smear is actually looking for. Not only that, is that sometimes you can have HPV in your system for a while and it does not present itself until later. So you cannot say that because you have Set you have one partner, you do not need a pap smear. Whether or not you have one sexual partner, you need to ensure you get your pap smears done. So that's a misconception that we need to eliminate. Take it one side and brush it away, get it out the air, get it out the place. Okay, ladies? So one more thing that they said, that if a pap smear actually is a test that checks for sexually transmitted infections, it is not necessarily. No, it is not. Let's just say it is not. The thing is that depending on the lab that is going to, some of these labs do check for other STIs as well. But you cannot get a pap smear just to check for STIs. The only STI that it really checks to see if there's any abnormal cells that can be related to that is an HPV. But an HPV test is completely different from a pap smear. An HPV test, same procedure, same insertion of speculum, assessment of the cervix, just like that, but it specifically tests for human papilloma virus. A pap smear checks for abnormalities or for cancer at the cervix. So it is not necessarily a test that tests for STIs. It's just that some labs will test for other STIs because it helps to eliminate some of the abnormalities that were found at the cervix. So let me reiterate, a pap smear is not a test to identify if you have a sexually transmitted infection. It's just that some labs go out of their way for you beautiful ladies to ensure that they do this, just to rule out some of the findings that they have and to make it a little bit easier for the patient and for the doctor. All right, so it does not test for an STI. A pap smear tests for problems of the uterus. No, it does not test for problems of the uterus. It checks for abnormal cells that are located at your cervix. Now, your cervix is otherwise called the neck of the womb, which is your uterus, right? But the cervix is attached to the bottom of your uterus, and it is the part that extends into the vagina. Now, that part is more susceptible to HPV virus because that is where all of the sexual fluids come into play, all of the interactions with foreign bodies. All the interactions with foreign bodies, right? And so therefore, that's where the pap smear test. It does not test for problems associated with your uterus. So if you have uterine fibroids, it is not going to show on a pap smear test because a uterine fibroid is normally felt by palpation with your hands or seen during an ultrasound examination. Also, if you have uterine cancer or cancer of the ovaries or any cancer associated within the uterus or around the uterus, where the uterus is located, it is not picked up with a cervical swabbing or a pap smear or pap test. However, if the cancer metastasized where it spread to the cervix, then it will be able to pick up that there are abnormal cells there, and then of course you'd have to go in for more testing. And likewise, if you have cancer of the cervix, it can also metastasize and spread to other areas as well. All right, so the pap smear does not check for anything related to inside of the uterus. Some people say that you do not need a pap smear if you got an HPV vaccine. if you are vaccinated with the HPV vaccine, you do not need a Pap smear. Nope, that's incorrect. Remember that cervical cancer is not just a cause because of the HPV virus. You have women who are smoking who are at risk for cervical cancer. You have persons who are HIV positive or immunocompromised for any reason whatsoever. And then you have persons who have family histories of cervical cancer, persons with previous history of cervical cancer. These persons are at risk for developing cervical cancer, not just if you are exposed to HPV, right? There are only two forms of HPV that causes cervical cancer, and that's HPV 18 and HPV 16, and that's what we test for when we do an HPV test to ensure to see if we can pick up these viruses present and so on. But the HPV vaccine, even though there's some HPV vaccine that covers all sorts of HPV virus, and one of the reasons why they do this is because HPV also causes genital warts. And the other forms of HPV, they don't cause cervical cancer. So they try to prevent persons from getting genital warts. Because it's also a sexually transmitted infection, they give the HPV vaccines to cover that and also to prevent cervical cancer. But bearing in mind that there are other reasons that can cause cervical cancer, even if you had an HPV vaccine, it is very important that you get your cervical test, your Pap smear or your Pap test done routinely. Okay, ladies? So we have a few more to discuss. But let me ask you a question. Have you subscribed? No? What are you waiting for? Have you liked? And have you been sharing my videos? Please share my videos. Do not be selfish. Remember that there are a lot of persons, whether they act as if they're informed or not, that they need to hear this too. We need to help each other, and we do this by ensuring that we share the information that we have. So share my videos and ensure that you subscribe. Subscribe so that you can be in the know, and every time I post a video, make sure you click on the notification bell so that every time I post a video, you get notified and you are among the first person to get the videos and get updated on everything that is going on, okay? Don't be afraid to comment. Say what you have to say in the comment section. I don't bite people. So ensure that you comment, like, share, and click on the notification bell and subscribe to my channel. All right, ladies and gentlemen, because you can pass the information on to your lady friends, your daughters, your wives, people that you know, co-workers. A lady loves a man who is informed. Be in the know, guys. So, depending on where you are in the world, right? Some people will say, if you do not get a call back, that means you're good. Your test is good. Listen, there are so many people that I've tried to locate up until this day. No one knows them. No one knows where they live. No one has any contact information for them. The information that they give us no longer works. No one knows their next of kin. No one knows them in the community. And we need to get to them, right? So if you do not get a call, do not take it for granted that your result is fine. Know that here in Jamaica, a lot of women has this misconception, and it's completely wrong. If you do not get a call for your result, ensure you go back to your care provider and get your result. Let your care provider say to you, your last test was normal. Sometimes your test is normal, but it requires a routine. Now, the lab can say that you need a routine check in 6 months or do routine checks because probably there are going to be changes there. Every result does not say routine test recommended. So you need to ensure that you go back to your care provider and get your result. It can mean that they're trying to locate you and they cannot get to you. So if they cannot get to you, there's no way you're going to know for sure that your pap test was normal. So please get that out of your head. Tell your friend, tell your neighbor, tell your church sister, tell your church brother, tell your pastor, tell your co-worker, tell your family and friends. Go to the dance, take the mic, and tell the people in the mic you never get your pap smear result. Go down at the clinic and go get it. Okay, ladies and gentlemen, so just ensure that you go and get your results, okay? And if you did not understand a word I just said, you didn't miss anything. Just ensure that you got your pap smear result back from your care provider. All right? The next thing, if I get a call for my pap smear result, that means I have cancer. No. It does not mean that you have cancer. It can mean that there is an STI there that needs treating. As I said, some labs, not all labs, some labs will test for it. And if as your care provider we see it, we're going to call you in for testing. Sometimes we see it when we're doing the test, and so we'll recommend and refer you to get the test, the treatment done at the same time. Also, we would call you to ensure that you actually were treated. So you can just come in and repeat your pap smear test if it is recommended for you to repeat it. And sometimes the infection that is there actually distorts or obscure the slide, and so the test could not be done. And so the cytologist will ask you to repeat the pap smear after you've treated. Or if it's unsatisfactory and because of severe inflammation, we'll just treat and repeat. All right? So it doesn't necessarily mean that there is cancer. So do not let your heart be troubled if you get a call. Just come in and get your result, and we'll talk to you and tell you what is happening, why we call you. Do not ask for the result over the phone, because we do not give you result over the phone. All right? You do not need to put your track shoes on and run to your care provider. You just need to come in on the day that we ask you to come in for your result. All right? So remember to sound off in the comments if you have any question. Remember to click on the notification bell. Remember to subscribe. Don't forget to share. You need to share. You cannot be mean with information. The more you save or share information, the more you retain. So please share. So you remember that we just spoke about HPV vaccination, and I told you that even if you have the vaccine, you still need to get your HPV test done. Well, some people say that if you are not sexually active, you do not need a pap smear. So if you remember going back to my other video when I told you that once you reach 21 years and older, you need to get a pap smear done. And if you reach 65 years, you do not need it, but I recommend it because there's always a risk for cancer. There's always a risk for cancer, especially if, as I stated before, smoking, immunocompromised, i.e. HIV, AIDS, or other viruses or illnesses that can cause you to become immunocompromised. You need to get your pap smear done, right? So you don't need to get it only if you are sexually active. Once you reach the age of 21 years, please go out, speak to your OBGYN, speak to your family nurse practitioner, speak to your midwife, wherever you are in the world, whoever provides the service, ensure that you go and get it done. Please do not be fooled, do not be misled, and then later on, you are going to ask yourself, if only I knew. Be informed. There's so many ways, there's so many information. This is the technology age. This is the renaissance of technology. So we need to ensure that we inform ourselves, get in the know for ourselves, for our children, for our children's children, so that we do not spread the misconceptions or the misunderstandings of our earlier people. We can have the information for ourselves and can make informed decision. So no, if you aren't sexually active, you still need to get your routine Pap smear done. And if you remember, please sound off in the comment. Let me see. Don't go back to the video. Let me hear you say, tell me, how often should you get your Pap smear done? And how often do I recommend that you get your Pap smear done? Some say that a Pap smear is an HPV test. No. I said it before. There are two different things. A Pap smear test and an HPV test, completely different. Yin, yang. One checks for HPV, the presence of the HPV virus, that is the HPV test. Same procedure, different test. A Pap smear checks for abnormality of the cells that can cause cancer, or if there's cancer in situ. That means if there's cancer inside or cancer at the cervix. So they're completely different tests. Do not get it twisted. All right? So ensure that you know this. If you aren't comfortable, you want to find out, go search. Information age, people. So as I was saying, not because you got a call, that doesn't mean your results, it means that you have cancer, right? So an abnormal result does not mean you have cancer. You can have problems that are causing, that can later cause cancer. You have infection present that can later cause cancer. You have abnormalities of the cervix that need further assessment to rule cancer out. It does not necessarily mean that you have cancer. I have rarely received a result that says cancer is there. And if cancer is there, it means that you took a very long time to get your Pap smears done, and so it has already proliferated and turned into cancer. All right? So, this is the thing that a lot of Jamaican women are guilty of. And that is, they do not get a Pap smear until they have a baby. No! Your Pap smear should be done routinely once you turn 21 years old, whether you are sexually active or not. So it's not every time you have a baby you get a Pap smear done. So if you do not have a baby for the next 15 years, for 15 years, no Pap smear is done. No. Your Pap smear is done at least every 3 years. I recommend every year for 2 years, and then every other year if you have a normal Pap smear 2 years straight. For persons who have had abnormal findings in their Pap smear, I recommend it yearly. For persons who have had HPV, I recommend 6 months, but your doctor may recommend otherwise. So you can listen to what your doctor says. All right? But that's just my recommendation. HPV normally takes about up to 10 years to turn into cancer, but that doesn't mean that you don't check for your Pap smear test more routinely to ensure that if it is there, we sort it out as soon as possible, because HPV that's left untreated can cause cancer. All right? And HPV for younger persons, normally the body will get rid of it, but some people will say it never really leaves your body, but then you have persons where you check them back and it's not there. It's as if they never had it in the first place. So your body can sometimes get rid of it on its own, and that's for the younger person, right? Under 21 years old. Up to 21 years old, you need some form of assessment. So you do not wait until you have a baby to get your pap smear done. You do your pap smear routinely. All right, ladies? So I'm going to come back to you in another week to discuss some other things. But if you have anything that you would like me to talk about, that you'd like me to go over, or if you'd like to discuss in my next video, please sound off in the comment section and let me know. I'm not afraid to challenge anything, to learn new things with you, and to teach you what I already know. Until then, this is your midwife, Taylor. I'll see you another time. Bye.